Hey everybody, it's Dr. Joe and Unicorn Remy, and today I'm going to show you my top 5 ways to relieve cervical stenosis. So let's get started. Disclaimer alert, disclaimer alert. So for cervical stenosis, which is stenosis in your neck, and stenosis is just narrowing of the canals where the nerves go out. And so when those canals get smaller, then it presses on the nerve, and that's what causes a lot of the pain. So going back into extension a lot of times will aggravate that pain because it'll make those canals even smaller. So what I want to start off with is an active range of motion movement combined with isometric exercises. And so isometric exercises are basically you're contracting the muscle but you're not moving, so it makes it less painful. And then you say active range of motion, isometrics, not moving. How do I do that? Well, you're going to start off with the isometric exercise. So you're going to push into something, usually your hand, to get that activation of the muscle and then relax. And then you're going to do that a couple times and then do the active range of motion. Because a lot of times if you're limited in the motion and you do those isometrics, then you'll have more motion. So we're just going to start off with the cervical side bending. So if you're going this way, and let's say you just try it once or twice and it's pretty tight, I'm just going to place my hand on the side of my head and I'm going to push into my hand going that direction. But I'm not going to go anywhere because I'm just pushing into the hand. So just push for about 3 to 5 seconds. I'm really just not pushing at 100%, maybe just starting off with about 50% of your push. But push into it, relax, do that maybe twice in one spot. And then try going over again and see if you get a little bit further than you did before. If you do, then go over a little bit just to the point where you're maybe starting to feel some pain, and then do that isometric exercise again. So pushing into it, relax, pushing into it, and then lots of times you can then go even more into that range of motion after you do that. So do that on both sides, pushing in, going a little bit further, pushing in, but when you're activating the muscle, you're just staying in one spot. So you can do that with side bending. You can also do that with cervical rotation. So this time I'm doing this motion, but now I'm just pushing into my hand again, but the motion that I'm doing is this. So if I get to here and it's tight, then I push, push, relax, and then usually I can turn just a little bit more. So that's the way to kind of combine them together. And usually it's really good because it just helps kind of loosen everything up, but you're strengthening at the same time. So then the next one is going to be a chin tuck. So with chin tucks, if you've seen some of my other videos, it's really one of my favorites because it's not only a stretch, but again, it's an exercise as well. So with a chin tuck, you're not tucking down, but you're taking that chin and tucking it back. You want to keep your chin at a level, kind of neutral position. So you're not pushing in like this, you're not pushing up like this, but just straight ahead and taking that chin and pushing back. So it's almost like if there was a wall here, you're trying to push your head into that wall. And then it's going to give you like lots of little chins right there. So just holding it for about 3 to 5 seconds in that position. So you're pulling in, holding it, and then a lot of times you'll see once you let go, you're not going back as far because it's kind of resetting all those muscles. These muscles get really, really tight, and a lot of times when those muscles get tight, again, is pulling on those vertebrae and really shortening, making those canals a little bit smaller. So if you have those nice and loose, it helps relax that area and then doesn't put as much pain or pressure on those nerves. So you can do those 5 times, holding each one 3 to 5 seconds. So then the next one is just going to be a full stretch. So you're going into getting those 30-second holds doing 3 times. So we're going to do an upper trap stretch. Those upper traps all the way up here in the back of the neck. So again, when those are really tight, that causes a lot of pain and it puts pressure on that cervical stenosis. So having those looser will take that pressure off of that area. So the side that you want to stretch, take your hand and just kind of sit on it. If it's too uncomfortable to sit on it, if you're sitting in a chair, you can just kind of take your hand and push it down. But by sitting on it, it keeps that shoulder down to give you a better stretch. If I'm stretching my right side, then I'm going to take my left hand and I'm just pulling my head over like I'm trying to get my ear to my shoulder. So I'm just giving a gentle pull and I should feel a stretch right kind of in the back along the side of the neck through here. And again, so you're holding it for 30 seconds. And with the stenosis, I would definitely do both sides. So then after the 30 seconds, then switch, hand underneath, pulling over to the side. It should be a comfortable stretch, kind of tension and pressure, but not painful. So 3 times on each side. I usually alternate back and forth. If you want to do them all on one side, you can, but you don't have to. So the next stretch is going to be a levator scapulae stretch. That muscle is the one that's back here. It connects to your shoulder blade or your scapula, and then it pulls it up like this, but it comes all the way up into the neck and that cervical spine. So when it's tight, it puts a lot of pressure on that spine again. And also stress when you hold it up there causes a lot of pain too. So it's really good to stretch out. So this time, the side you want to stretch, you're just going to take your hand and kind of put it back here where you almost want to take that elbow and point it towards the ceiling. If you can't do that or that's uncomfortable, that's okay. You don't have to. That's just, again, pulling or pushing that shoulder blade down to hold it in place. Some people just hold their arm up. That's fine to do too. I just like it a little bit better like this. Then you're going to take the other hand and put it behind your head, and you're going to not come down straight forward, not out to the side, but kind of at an angle. So take your nose and go down towards your opposite knee. That's the angle you want to go to. And then you're just going to stretch through this way, and you should feel that stretch right back through here. So again, it should only be tension, a little bit of pressure. It shouldn't be pain. And holding it for 30 seconds, doing 3 on each side. So the last one is going to be an anterior scalene stretch. And again, these muscles in here have a lot to do with that whole cervical region. So when they're tight, they're just pulling and putting a lot of pressure in that area. And so getting those loosened up is really going to help that stenosis. So this time what you want to do, if I'm stretching this side, I'm going to take my opposite hand and just kind of place it on my collarbone or that clavicle right there. Then I'm going to turn my head away and then lift up my ear like I'm taking that ear towards the ceiling. And I should feel that nice stretch through right here. And just kind of holding that collarbone down there just helps enhance the stretch a little bit. So you don't have to, you can just kind of turn and look up. But I always get a little bit of a better stretch if I pull down that way. So again, this is another one where you're doing it for 30 seconds, doing 3 on each side. So those are my top 5 ways to relieve cervical stenosis. If you'd like to help support my channel, make sure and click on the link up there. And don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.